The World Health Organization (WHO) on Friday, May 5, 2023, declared an end to the COVID-19 global health emergency. WHO has lifted alert levels which were imposed on the world for over 3 years. The decision was made by WHO Director General Dr. Tedros, given the downward trend of the pandemic. This, however, does not mean COVID-19 has disappeared. The virus is here to stay, but through technology, it is now being treated like any other infectious disease.
Since it was a new disease, we didn't know much. We didn't know a lot about the disease. We didn't know how to detect it. We didn't have a test for it. We didn't have medicines against the disease. And all of this we were able to do within a very short period of time. So we have now a much better understanding of the disease. So having all these new tools in place and countries having worked hard to reduce the burden of the disease within their own countries, I think when the WHO looked at all this information, they felt comfortable that it's time to make such a declaration that it's no longer a public health emergency globally.
To actually reach this phase of normalcy, strategic steps were taken by global leaders to combat the COVID-19 pandemic. In this feature, we will highlight the measures taken by Guyana.
In late 2019, the world was caught off guard as news of a novel coronavirus started to emerge from the city of Wuhan in China. It wasn't long before the virus began to spread to other parts of the world. The beginning of the pandemic was marked by chaos and confusion as governments struggled to contain the virus and healthcare systems were stretched to the limit.
Guyana recorded its first case on March 11, 2020. Assuming office 5 months later, the PPPC administration now had all its challenges exacerbated by the COVID-19 pandemic.
Government decided to implement several measures to bring us to the stage we are right now, including early border closures and travel restrictions, robust testing and contact tracing, strict lockdown measures, vaccine distribution and vaccination campaigns, collaboration with international organizations, and strengthening healthcare infrastructure. In the last 2 years, the COVID-19 pandemic caused serious health, social, and economic damages in Latin America and the Caribbean region. But the government of Guyana, using the safety guidelines provided by WHO, was able to reduce the number of infections and deaths. Government was able to secure a significant amount of personal protective equipment, PPE, testing kits, and vaccines. Mass testing was also done in every region. Guyana was able to receive from Barbados its first batch of vaccines for frontline workers. Guyana was one of the 10 countries in Latin America and the Caribbean that received vaccines at no cost through the COVAX Advanced Market Commitment (AMC). Guyana was the first AMC country in the Caribbean to receive the vaccines through COVAX. In 2022, through the government of Spain, Guyana received a shipment of 52,800 doses of the Pfizer vaccines for children ages 5 to 11, preparing the country for the first-time administration of the vaccine to that age cohort. Over $7.5 billion in COVID-19 cash grants were disbursed to households countrywide in 2022 to cushion the impact of the pandemic.
Guyana, though not exempt from the effects of the COVID-19 pandemic, has managed to overcome the challenges that accompany this dreaded malady.
Having considered the economic performances of countries during the period 2019 to 2021, the World Bank determined that Guyana recorded cumulative economic growth of 72%.
All of these measures have led to where we are now, where we can be with our loved ones, visit our favorite places, and maximize the benefits of life. However, it is vital to remain vigilant.
So we have to continue to be vigilant. Our surveillance systems are pretty much in place. We have been monitoring cases, although over the last couple of months we have not seen many cases. And we, of course, monitor hospital data as well